Hey everyone, Luke Gordon here. In this video, we're talking about total knee replacement surgery, and the specific topic is a manipulation under anesthesia, commonly called an MUA, and just figuring out if you think you might need a manipulation under anesthesia, how to kind of figure that out and what that looks like, and also talk about the timing of it. And just to kind of preface this video, there's no one-size-fits-all for determining if you need a manipulation. So it's not like, hey, if you're 4 weeks out and your knee is only bending to 100 degrees, now you need one, or if you're 6 weeks out and you're only at 110, now you need one. It's not quite that black and white. It's not quite that linear, but there are some very key things and ideas and kind of benchmarks that you want to key into to help you decide if you think you're getting to the point where your knee is kind of just plateauing and you think maybe you do need to go visit your surgery and have them do the manipulation. And then just to clarify too, a manipulation is when they actually put you back under sedation, actually under anesthesia, so you're all the way out. And then the surgeon would forcefully bend and straighten your knee. And basically, when they do that, they're tearing the scar tissue of your knee. So that's just a little background on what a manipulation actually is. And again, it's usually for when you're thinking you're very much stuck with your motion. That's when you would consider it. So a few things I really want to highlight in this video, so we'll just kind of work through them. The first one is anytime you really feel like your range of motion is stuck, particularly your ability to bend your knee, which we call flexion. So, you get out of surgery and, your knee is very tight and painful, and then you're getting, 60 degrees, 70 degrees, 90 degrees, 100 degrees, all the way up hopefully towards like 130 degrees is your end goal for flexion. Along that journey, what you really should feel like is that you're always gaining. Week to week, that number is building. So whether you're kind of like ahead of the curve out of surgery or you're behind the curve and your knee is really painful and stiff and swollen, it doesn't matter a whole lot if from week to week you're making steady progress. Now again, that could be 5 degrees a week, it could be 10 degrees a week. The number itself isn't quite as important as the fact, are you making progress? Is it continuing to get better? And typically as long as it's getting better, you're good. But if you get to a week and you're like, man, I can't get past 90 degrees, I'm stretching hard, my therapist is pushing me hard, and I just can't get by it, and I was at 90 degrees last week too. Now you're a little more concerned. On the same token, say you're at 110 degrees and you're a little farther out now, maybe you're 4 or 6 weeks out, but again, from last week to this week, you feel like you haven't made any improvement at all, and your knee is feeling super stiff and super painful, and you don't think it should be. That's your number one indicator that you might need to go talk to your surgeon about getting a manipulation, because if you're stuck in that scar tissue, despite your best efforts to really stretch it and really get it to move, just isn't moving, now you've got a problem, and that's when you might consider the manipulation. Also, a little background on the manipulation. In my opinion, as soon as you can figure out that you do need one, the better. Don't go 2 or 3 weeks without making any gains in range of motion before saying, hey, maybe now I should talk to my surgeon. More like 1 week. So that's your first indicator, anytime you feel like you're stuck. To piggyback that one, if you have a lot of persistent stiffness, especially in the morning or anytime after you've just like sat for say 20 minutes and every time you get up, the knee is super stiff, you feel like you're kind of starting over. Yeah, you can warm it up on the bike or by walking or doing some stairs or doing your stretches, but then you feel like every day you're constantly going back to where you started. That's another indicator that you've got a lot of scar tissue going on and that you might need a manipulation there too. So combine that with the first one where I talk about, if you feel like you're stuck, and especially if you feel like you're working way too hard and you're just going back to square one every day. Overall, you should feel like things are getting better every week with the motion, with that sensation of stiffness, and it shouldn't be like that super tight every single morning. So that's another thing to consider. One other factor I wanted to mention, then I've got a couple more and then we'll wrap up this video, is if you have a previous history of really scarring down heavily, say you've had a previous knee surgery or a shoulder surgery or a neck or a back surgery or something like that, and you just know that your body lays down really thick scar tissue, like keloid type tissue, and you've had issues with that before, issues with a frozen shoulder or something, just keep that in mind, that you might be a little bit more predisposed to needing a manipulation to begin with. So keep that in mind. Years ago, I had a woman who did her first total knee with me. We pushed so extremely hard, pushed just the lights out of her to the point where she, was almost crying, just couldn't get her knee to move. She had a manipulation, ended up having 2 manipulations actually, and that worked, and we got her to her end goal. About a year later, she did her other knee, same thing, total knee, and we just knew off the bat, like, hey, her name was Judy, I believe. Judy, if your knee isn't moving within the first couple weeks, let's just get that manipulation going. And that's what she did, and the surgeon was aware of that too, so they just scheduled it. So that was good. So again, your previous history with scarring is very important too, just to take that into account. A couple more things just to wrap this up. Most of the time we talk about manipulations, we're talking about because your knee won't bend or flex. Sometimes you can do it if your knee won't extend as well. So if your knee won't extend, like say you've got 15 degrees, you know, that you can't extend all the way, that's another thing to keep in mind. So it's not just for flexion, it's also for extension or straightening. And then also keep in mind that typically for most surgeons, you have a window of opportunity when it comes to manipulation, meaning that if you get to a certain point, say 3 months out or 4 months out, depending on the surgeon, they will not do it after a certain point because at that point it's too risky that they could actually hurt your knee. So again, going back to earlier in the video, if you think you need one, talk to your surgeon right away, talk to your therapist right away, and just act quickly. Don't let them push you off, for example, and just be your own advocate. Last thing I want to say in this video is that if the cause of your knee not bending is that it's really swollen, I've got some really good information on that I'll link to the end of this video. But keep that in mind. If you feel like you can't bend your knee because it's just so super swollen, even after 3, 4, 5 weeks, keep that in mind. Again, I've got some information that can help with that. Make sure you're doing everything you can to get that swelling down. So hopefully keep you away from manipulation. At the end of the day, you really don't want one, but if you can't get that motion and you need one, it's just best to do it as quickly as possible. So I hope that helps with the manipulations in general. Again, those MUAs, if you have experience with them or want to leave a comment to help people watching the video below this, that would be great. And if not, thank you for watching. Please like and subscribe before you go. That's it. Have a great day.